speaker today, Dana Coppola, and she's here from New Jersey. She's a director of development, getting her master's in corporate and organizational communications at Northeastern University. So Dana, I'm going to turn it over to you. It's all yours. Thank you for being here. She came down by train today to be with us.
Thank you so much to the Rotary Club of DC for having us here today, and a special thank you to Dr. Ayubi, Dr. Sam, and Sterling for helping to arrange this incredible opportunity. My colleague, Mr. Savas Matin, and I are so thrilled to be here with you today to share about how Embrace Relief is combating the clean water crisis by providing access to clean water throughout sub-Saharan Africa. Embrace Relief is headquartered in Fairfield, New Jersey, and we are an international 501c3 nonprofit organization, and we're dedicated to providing research-based, sustainable, and innovative solutions to achieve lasting solutions and outcomes for communities and individuals experiencing both emergency and ongoing hardships. We ensure comprehensive programs by working closely with our partners as well as those we serve in order to ensure the most beneficial services and lasting outcomes. We were originally founded in 2008 as a disaster relief organization, and we have 8 core programs that we focus on in order to promote sustainable development as well as humanitarian aid around the world. So you'll see here on our program wheel the 8 core programs that we have. As I mentioned, we were founded in 2008 as a disaster relief organization. So over the last 15 years, the foundation has truly undergone transformational change to blossom into a multifaceted humanitarian aid and development organization that it is today. You'll also see that there are many programs up there and focus areas that do align with the International Rotary's strategic goals, such as the clean water, women and children's empowerment, like how the Rotary Club in Uganda is doing, as well as women and children, and health and medical supplies. In fact, I've actually been working with more Rotary clubs around mostly the Northeast, I guess, well, just New Jersey, and the one in Afghanistan. But for the Rotary Club of the Caldwells in Northern New Jersey, they actually sponsored our annual 5K for clean water, which raises awareness and money for our clean water program. So they sponsored that 5K, which was really exciting to build that relationship. And we're also working with the Rotary Club of Kabul City in Afghanistan to get medical supplies and equipment into the country with the partnership of Project Cure. So it's really amazing as an individual to see the extensive reach and impact that the Rotary Club has. Ever since I was young in Girl Scouts, I had always heard of the Rotary Club, was never really sure what it was about. So getting to come to these meetings, learn more, and become more involved personally is inspiring to my humanitarian spirit, because I see that people from all walks of life, established professionals coming together for the cause of making our world a more equitable and sustainable place. I'm here today to share with you about our clean water program. So this visual provides an oversight of the impact and reach that Embrace Relief Foundation has had with all of our programs. So we have implemented projects and programs in more than 65 countries around the world and have impacted the lives of more than 7 million people. So that's just a visual representation. And this is just a quick testament to Embrace Relief's dedication to accountability and transparency. You can see that we keep our overhead costs extremely low so we can allocate as much of the donations that we get directly to programs. And with that, we're able to allocate upwards of 94% of every dollar donation directly to the programs that people support. So we think that's really important as a nonprofit organization, of course, to show transparency, accountability, and all of this information can also be found on our website. So getting into the meat of my discussion today. Although the number has been steadily decreasing over the last couple of years, actually the last time I checked, I think last year was about 400 million. There are still 350 million people across the continent of Africa that do not have access to clean water. This accounts for about 65% of the entire population. So still more than half the population does not have access to clean water. In addition, there have been millions, if not billions of dollars invested into the clean water crisis. However, at any given moment, up to 60% of water wells that have been built in Africa are broken. Now, this can be due to inadequate construction. Maybe it was dug too shallow, so it evaporated, or it could have broken just due to the materials breaking down. In addition, individuals and communities such as 8-year-old Zenaba on the screen facing the brunt of the clean water crisis are exposed to very serious and deadly diseases such as cholera, typhoid, and dysentery. And in 80% of households across sub-Saharan Africa, women and girls are responsible for water collection, which is a quite literally very heavy burden. These canisters can weigh upwards of 70 pounds, especially for these young girls. It can lead to serious spine, neck, back injuries. And the journeys can last, depending on the area, anywhere from 30 minutes to 5 hours. A one-way trip, 5 hours. We've actually met some people who do those trips, and it takes them all day to collect one canister of water for their family that is still actually contaminated because they're walking to an open water source, such as the one you can see behind her in the picture. You can't see inside, but what those people are standing on, in front of them is an open borehole where about 17 villages for almost 20 years were collecting water from. So Embrace Relief, this is in Chad, and we were able to provide these communities water wells. So now that borehole is no longer providing them that glass of water. And you'll see on the last bullet point, it says basically that from the math that there are approximately 200 million hours that are invested into collecting clean water every single day. Again, this falls primarily on women and children. So we can only imagine the impact that, or the changes they could be doing in their lives with that time returned to them, including going to school, being trained for a job, or even selling things in the market. So there is definitely a need for addressing the clean water crisis in an innovative and sustainable way. At Embrace Relief, we are addressing global inequality and the clean water crisis by advancing locally led development through building and reconstructing water wells in some of the world's most water-scarce countries, including Chad, Cameroon, Nigeria, Uganda, Kenya, and Tanzania. Since 2013, we have provided clean water to more than 975,000 people, and we are extremely proud to share that 100% of our water wells are still fully operational and still providing clean, high-quality drinking water. Our clean water program operates in 3 different ways. We offer 3 different ways to combat the clean water crisis, basically depending on the need and the funding that Embrace Relief has available. And that begins with a standard water well, which can serve a community of anywhere to 1,000 to 5,000 people. And these are built in all of the countries that I just mentioned earlier. However, a very unique and sustainable aspect of our clean water program is our Fountains of Hope initiative. So this initiative, as you might just remember, I shared that up at any moment, 60% of water wells are broken in sub-Saharan Africa. And Embrace Relief actually sees this as an opportunity to reinvest in communities and renew hope. So Embrace Relief goes to these communities where these water wells are broken, and we're able to reconstruct them for a fraction of the time, cost, and resources needed to build one from scratch. And the reconstruction process includes anything from digging to resealing to even exchanging parts. So it's a very comprehensive process. And to date, I believe we've reconstructed more than 180 water wells. So very exciting. And more recently, we have started building very large water wells, and these water wells are in communities of 10 to 15,000 people. These water wells are different because they're dug much deeper into the earth, and they're also equipped with a 5,000 liter tank on top, as well as 2 offshooting water collection spots. So there's really 6 or 8 spouts that people can get water from. So on the screen, the bottom picture is one of our standard water wells in Tanzania, and the one above is a reconstructed water well. So you can see we also name our water wells, which are really great. Some people choose Bible or Quran verses. They'll choose, a saying by a famous author or their family name. And this is a overview of just one of our large water well projects. So you can see it has the 5,000 liter tank on top. It has 2 water spigots on the main one, and then 2 auxiliary locations about 100 to 150 meters away from that main well. So we're really able to reach people in these really large communities. So there's not, over a dense population around the well, or there's no fighting over to get the water. I am going to be getting a little bit more into the weeds of our clean water program. So just explaining a little bit more about how our wells are dug and the impact that it's having in the communities in which we operate. All of our wells are dug and constructed and water tested, in accordance with government, local government, regional standards, as well as the World Health Organization. Our new and reconstructed wells, which is what you see in this diagram, are dug a minimum of 45 meters, approximately 150 feet. And this is deep enough to filter out bacteria, contamination, and it also is the second or third pocket of water where there's vast aquifers, so the water replenishes, it's definitely more clean. And that first pocket of water, where unfortunately some organizations who do water construction, water well construction, digging, they will only go to that first pocket of water, be very satisfied that they hit that water. However, because of the sanitation and hygiene practices, it becomes contaminated very quickly, and that water can even just evaporate right out of the ground during the really hot months. And we know that it gets extremely, extremely hot in sub-Saharan Africa. So digging to these depths ensure that our water wells are able to continuously provide clean water. The exact depth of each well, however, is determined on factors such as soil composition, water quality, and the seasonal variations of those water tables. Prior to implementing any well projects, this is where Embrace Relief's research-based practices really come into play. We have an extensive network of partners all around the world, and our clean water partners really help Embrace Relief conduct geographic and demographic research on the regions in which we are looking to build water wells. And this helps with understanding the need and prioritization of where to build wells. For example, key metrics that we look out for are the amount of time that a community has not had clean water, the distance that a community must walk for clean water, as well as demographic or population indicators, such as if there's a lot of children in the area, if there's a lot of sick people who are getting sick from the water that they have, or if there's an orphanage, school, or medical clinic, then we'll definitely need to build water wells in those areas because it has dense populations of very vulnerable people. From these pictures, you may have seen that all of our water wells are manually or hand pump operated, and this is a strategic decision. After years and years of experience building wells in sub-Saharan Africa, we have found that they are easier to repair, easier to maintain, and easier for communities to use. And this actually leads us into the next point, which is on the next slide, but I'll keep it here right now. Embrace Relief has this wonderful aspect for all of our water wells, which is a lifetime warranty. So I did mention 60% of wells can be broken. Embrace Relief promises to never abandon any of our water wells. And we do this through this lifetime warranty, which includes annual assessments. So our partners and local teams in the fields go to these water wells every year. They'll do assessments, maintenance if needed. And if there is a major issue found that needs to major reconstruction or to be repaired, then we reconstruct that water well through our Fountains of Hope initiative. So it's kind of like a holistic cycle of providing the water, because in anywhere in the world, things are bound to break. And so we go back into there and we repair with our local teams there. And actually, we also promote locally led development because our teams teach community members how to do assessments of the well as well, and how to do very minor repairs. So community members are responsible and accountable for the health and safety of their water well. And if the community members cannot fix the well, or there's an issue that they don't understand, they call our partners. Our partners come out, do an assessment, make a fix if needed. If not, we do total reconstruction. So that is how 100% of Embrace Relief's water wells are still fully operational, providing clean water to date. So that was the first point on this slide, our lifetime warranty, which I truly think is a very unique and sustainable aspect of our Fountains of Hope and clean water program in general. In addition, I mentioned, Embrace Relief's vast network of partners. We really try to promote multi-sectoral collaboration. So we do this through partnering with governments, public and private entities and stakeholders, all of which play a critical role in each step of the process. And Embrace Relief, we don't just stop at providing clean water to communities. We also partake in WASH initiatives, which include hygiene and sanitation through constructing bathrooms, as well as WASH information sessions. So the picture on the bottom, that's actually one of Embrace Relief's constructed bathrooms that was done at a primary or secondary school. It's escaping me right now, one of the schools though. And these bathrooms come equipped with 12 stalls. One is handicap accessible, and they also have 2 hand washing stations. So even just this facility itself really promotes hygiene, sanitation, hand washing practices, and keeps also children, and more specifically young girls who are menstruating, it gives them the privacy and safety that they need in order to continue their education, which is extremely important. As I mentioned earlier, and as I'm sure all Rotarians are familiar with, the United Nations Sustainable Development Goals, we have a deep passion and dedication to addressing the SDGs. All of Embrace Relief's programs in some capacity address multiple SDGs. And as you can see here, these are just the main 6 that our clean water program addresses, which is, 6, clean water and sanitation through our building water wells, reconstructing. SDG number 3, good health and well-being, because it automatically, depletes the amount of diseases that people are getting, the sickness. Zero hunger, that one is. And this is because people use the wells for agricultural means to keep their animals hydrated, which means more food for families and communities. I think that one is decent work in economic growth, because people don't have to spend time going to collect water. They can spend time in school, learning a trade, selling at the market. Also zero poverty, because these people and these individuals can partake in these economic or academic ventures. And of course, partnership for the goals, which is very important to Embrace Relief with the governmental, private, and public multi-sectoral collaboration. To date, Embrace Relief has built over 950 water wells in the countries that I mentioned earlier. You can see the breakdown of the wells that we've built. So 770, right? That says 770. Sorry, I can't see. Standard wells have been built. Over 180 water wells have been constructed, and 6 large wells have been completed. So again, to date, almost 1 million people we're providing clean water to. And this will be a milestone that Embrace Relief will definitely celebrate. We're very excited to hit 1 million people and share that we're able to provide clean, accessible, safe drinking water to 1 million people around the globe. And just to give you an idea of current projects, in addition to many other projects that Embrace Relief has going on, these are some in Tanzania that are just a little more special to Embrace Relief. So our partners actually just did a research campaign in the region of Morogoro in Tanzania, and it's about 14 villages of over 600,000 people, 500,000 people who don't have access to clean water. Embrace Relief's game plan to address this problem is to build 12 water wells in the most densely populated areas, as well as 2 water wells in other areas, so we can provide water to those people who are living in a little more remote regions. And there's another area in Tanzania called Bondo Village, which has a population of about 10,500 people, and it's actually split up into east and west. And so our game plan for that is to build 2 large water wells that will have 4 in total auxiliary wells, as well as providing WASH information sessions. This is just 2 examples of photos of pictures that we get from our partners on the field. So this is from Morogoro Village, one of the areas in there. So this is the current situation of where they're collecting water from. And it is just it's a stark reality that I think it's difficult for anyone to face, especially because water is such a basic, accessible resource that we have here. Even working in a humanitarian development nonprofit organization for 5 years, it still strikes a chord in me to see pictures like this and know that there are people in 2024 who are walking upwards of 5 hours to collect dirty and contaminated water for their families that could potentially cause a deadly disease. So as an individual and as a humanist, as a humanitarianist, this project and all of Embrace Relief's projects are very near and dear to my heart. And I think that these pictures kind of bring us back down to the base of why we're doing this. After that, a fun way that I wanted to kind of wrap up this presentation is to share how Embrace Relief activates, mobilizes, and involves our donors and people involved with Embrace Relief. We have a really exciting program called Group Fundraising, which is basically fundraising for any cause that you're passionate about. You can be an individual, a club, a community group, a family, a group of friends, a company, and you fundraise for a cause that you're passionate about. For example, in this picture, they did for water wells. And then with group fundraising, we offer groups the opportunity to also travel to the destination or location where their project is being implemented. We have sent 6 groups so far just this year to places like Tanzania, Kenya, and Uganda. And this is really wonderful for any types of groups, getting the youth, getting young people involved in humanitarian work, informing them about the global issues and how, as an individual, they can be a part of the change and take action. A couple pictures from groups that went this year. So you'll see the water project with the 5,000 liter tank on top. We also did some medicine distributions in Uganda, a bathroom renovation, as well as a group visited an orphanage. And I believe they either did a renovation or did food distributions. But it's wonderful to be able to send groups so people can see the impact that their project is having, and they can even make networks and friendships that will last an entire lifetime. With that, I would like to say again, thank you all so much for having Embrace Relief here to share how we are combating the clean water crisis by providing clean water throughout sub-Saharan Africa. Thank you.
Thank you for your presentation on this very impressive organization. My question is this, I don't know if you can answer it or not, but I'm always curious how far countries are away from being able to provide clean water for their residents. Is this just beyond the realm of possibility in the next decades, or do you have any idea?
Personally, for that, like, as statistical, scientific, fact-based, I don't know, but I've had the opportunity to actually travel with Embrace Relief to countries including Mali, Burkina Faso, Ethiopia, and from what it looks like, it's an infrastructure issue. And then there's also just so many other basic needs that people aren't getting, like food, education. There's civil and political unrest. So that also, breeds corruption and all those types of issues. So I think that it's important for organizations, thank you, for organizations, private companies, of course, government entities to align themselves with the United Nations SDGs. Because I've actually had this conversation and asked like people in the African Union and ministers, like, what would the number one topic or issue be to be the baseline to like start to build everything else up? And I've heard different responses. So I think that it's a very complex issue to address.
I saw on the map you have a partner in Japan or project in Japan. Could you tell me more about it? Because JICA and other organizations that really create a lot of opportunity for the clean wells and so forth. I'm curious about your partnership or collaboration with Japanese organization, if you could share that.
The work that we do in Japan is primarily disaster relief based. So more when a disaster strikes, such as a tsunami or an earthquake, we connect with our partners. And this is how we operate for all disaster situations, natural or man-made. Once the disaster strikes or happens, we connect with our partners on the ground. I don't have the name on hand right now. I would be more than happy, though, to go back and see who that partner is, and maybe we can connect further and see if there's any other room for programming. Yeah.
I only have 3 questions.
3?
Thank you very much for a great
Wait, hold on.
presentation. I loved hearing about it. The first one is really, I didn't see any pictures of the rigs going in to drill the wells. And I was obviously wanting to ask, presumably there's drilling rigs doing these wells at that depth.
Yes.
And then the related question is, most of the wells are in rural areas, I presume. I didn't hear whether you drill some also in urban areas. But getting the rigs to remote rural areas is often a challenge, as I'm sure you have experienced. I wondered if you could just say something about that. You must be dealing with local companies doing the drilling for you with their own rigs, I suppose, but maybe you could address that.
Yes, we do.
And one more question.
Yeah.
And then the last question is just about testing the water. Well, there's another question as well. Sorry. And
Go
how
for
often
it.
do you, how
gonna start
often is the
taxing you.
testing done? And do you sort of train the community people to do that? And then the related question is, how do you organize a community group or some sort of community structure to manage the well, look after the well, train them to do that? I think you did refer to that a little bit, but those are the issues that I was a little interested in.
Okay.
Thank you.
Perfect.
I hope you can remember all that.
Yes, I'm going to work backwards. So the community members to tend to the well are identified through basically the head of the community. So whether that be the chief, the mayor of the village or community in which we're operating. So, even digging the water well, we need permission from that mayor, from that village in order to do any type of operation in their community. And so from there, of course, that person knows everyone in the community, their capabilities. So that person helps to identify or volunteer these members who will help tend the well. Often community members will want to. It'll be about, I think, maybe 5 people who are trained, 5 people who are trained in the community. And then, so those people are identified in that way. The water testing happens every year during the annual assessment. Yes. And if, the community members can call our partners or our teams in the field if, for example, they do suspect something is wrong with the water, maybe it's coming out murky, and maybe people are starting to get sick, and maybe that water does need to be tested and some type of reconstruction needs to happen. So that's why we keep that relationship with the communities in which we work. We don't just build a well and say, see ya, you're welcome. No, we know that this is it's a partnership, a relationship that we're building with these communities. So that, I don't remember your other questions. The drilling, yes, we work with local companies. They get out there. How they do it, I know that they have very large trucks. I've seen the trucks myself. I've seen drilling happen myself. It is a timely process. It takes a couple days because it's so deep, and then all the different layers that they're going through. And I mean, where I saw the drilling happening in Burkina Faso, and it was in nearly the center of the community, and it was kind of difficult for the truck to get in there. They tried one way, it didn't work. They said stop, so they tried another way, and it worked. And then, that day we got to witness and kind of see them starting the drilling process. So yes, it is difficult to get to those remote communities, especially the extremely remote communities that are not in urban areas, but they do. Yes.
Yes, thank you so much. Mine are just 2. About the bathroom construction for the girls. Maybe I need more information, could do one-on-one. Then the other, have you ever received any resistance from the community? Because studies show that sometimes communities want to fetch water from a distance so that the ladies can socialize. And when you bring it closer to them, they miss out that social bit. I don't know if they've met that resistance.
I'm hearing from our clean water program manager that we have not faced that type of resistance. And I assume that's because of the relationships that we start to build with those community leaders. So, yeah.
Since I have the mic, I just wanted to intervene. The way I came to know Embrace Relief, I was impressed by their innovative approach. I love their mobile clinics. So they're so innovative. They're really working with the communities. They understand the need. And based on those needs, they also look at the resources within the community, like she said about the drilling, right? So they're using local partners. And that is where I just really thought that Embrace Relief was one of the most innovative and pinpointed development partners that we have had. And we are working together to make sure we are also supporting these mobile clinics.
Thank you, Dr. Ayubi.
Dana, thank you so much, Dana. Our club has a tradition of presenting our speakers with a tree planted in their honor and their name, and there will be a tree planted in your honor in Washington, D.C. There will be GPS coordinates So you'll know exactly where your tree is.
We got to do this.
And here's your certificate. You can come by and water your tree anytime.
This is amazing. Thank you so much.
And,